Hello guys, welcome and welcome to Meet International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and YT training. So we were discussing magic pill session. So every day morning you will be getting this magic pill session and we are discussing all the important topics whatever already asked in the previous year exam question papers. And today we are going to start once again with the nursing foundation only, and all the important topics we are covering in the nursing foundation. So if you like the video, please like it, share it, and if you have any doubts anywhere, please drop your message in the chat box. So let's begin the session. So today the topic what we are going to discuss is related to respiration, different abnormal respirations. Okay, so very important question. So many times these questions are asked in AIIMS, NORCET, JIPMER, ESI, RRB. So many direct questions, so many scenario based questions are asked. So based upon that, we have picked the question from that area and we are discussing with you. Okay, so let's discuss the first question. So respiration which is abnormally shallow for 2 or 3 breaths followed by the irregular period of apnea is termed as. So as usual, I used to say that the key points are very, very important. In this question, the key point is the first one is shallow breathing is present. That is 2 to 3 shallow breathing followed by the irregular period of apnea. Irregular period of apnea. Okay. See here you can see 2 to 3 shallow breathing followed by irregular period of apnea. There is a apnea means there is no respiration. Okay. So what condition is this? And they have given 4 options like Kussmaul respiration, Biot's respiration, hypoventilation, Cheyne-Stokes respiration. So here the right answer is option B, Biot's respiration. So why we selected this option? See here, the clear explanation, it is already present in the image. Okay, so in Biot's respiration, what is happening, you know, it is also called as, the first MCQ point is, it is also called as, Biot's respiration is also called as ataxic breathing or cluster breathing. This is the first vital point. It is also called as what? Ataxic breathing or cluster breathing. So here, what is the characteristics of the respiration? Several short breath followed by a long irregular period of apnea. Here in this image, you can see several short breath. So this is one respiration, this is one respiration, this is one respiration, this is one respiration. So several short respirations are present, followed by that a period of apnea is present. The apnea will be there. It will be long lasting for 20 to 60 seconds also. The apnea will be long lasting for 20 to 60 seconds also. So this characteristic is present means that is called as what? Biot's spot. Biot's respiration. Once again, I will repeat. Biot's respiration means irregular, several short breath followed by that a period of apnea. It will long for 20 to 60 seconds. It is called as what? Biot's respiration. Other abnormal respiration also we are going to discuss one by one. Okay, so listen carefully. So the next question is feature of Kussmaul respiration, or as you all know, Kussmaul respiration is very commonly seen among the diabetes patient, that is type 1 diabetes mellitus. So the type 1 diabetes mellitus, the complication is diabetic ketoacidosis. In that ketoacidosis, this Kussmaul respiration is very, very common. And let's see the options. What are all the options they have given here? So 4 options. The first one is respiration occurs for more than 20 seconds. Regular but abnormally slow respiration, labored breathing with increased rate and depth of respiration. If you know the characteristics or meaning of Kussmaul, answer is option D, that is increase in the rate and depth of respiration. So that is the right definition of Kussmaul respiration. So as I mentioned already, Kussmaul respiration commonly seen in diabetic ketoacidosis, and the characteristics of Kussmaul respiration is, you can see in this image. So this is the normal respiration and this is the Kussmaul respiration. In normal respiration, you can see the rate. What is the normal respiratory rate? So 15 to 18, in some books says 16 to 20, not more than 20. Not if it is going beyond the 20, it is called as what? Increased respiratory rate. Okay, so the normal one is 16 to 20. So that is the rate. Okay, so in this normal breathing, you can get only 16 to 20 respiration only. But here in Kussmaul breathing, you know, there are more respiration, the more rate in the respiration. The rate is increased in the Kussmaul breathing. Not only the rate is increased, the depth is also increased in the Kussmaul respiration. So 2 things are increased in the Kussmaul respiration. The first one is rate and second one is depth. If the rate and depth is increased in the respiration, that condition is called as what? Kusal respiration. Usually in acidotic conditions, this type of kusal respiration is very, very common. Okay, so here which is the right answer? Option D, that is increase in the rate and depth. That is the classical characteristics of kusal respiration. So rational is mentioned here. Okay, so the next one is chain stroke respiration means. What is the meaning of chain stroke respiration? Let's see the options. Hyperapnea, hyperapnea with apnea, tachypnea and eupnea. So chain stroke respiration. Here the right answer is what? Option B, that is hyperapnea with apnea. See, it is very easy to explain with the image. I have added the image also. Let's see that. See, this is the normal respiration. The rate you can see here, that is 16 to 20. It will be in between 16 to 20 only. Okay, this is the normal respiratory rate. And the depth you can see, the depth is also normal. Whereas just compare the normal respiration with the chain stroke respiration. Here in chain stroke respiration, two classical signs are present. Two classical characteristics are present. What is that? The first one is the patient will be slowly having hyperapnea. You can see here. Hyperapnea followed by that hypoapnea. Hyperapnea followed by that hypoapnea and then apnea. Okay. Again, hyperapnea, hypoapnea, apnea. So these are all the three things will be present. Hyperapnea, hypoapnea, apnea. Hyperapnea, hypoapnea, apnea. So these characteristics are present means that is called as what? Chain stroke respiration. Okay, so just compare the normal and the chain stroke respiration. It will be easy for you to understand the concept. Okay, so in which disease condition it is very common? See, if we saw kusal respiration, in acidic condition, kusal respirations are very, very common, right? So same way here, the chain stroke respiration, it is very commonly seen in brain tumor, brain injury, high altitude, and any inflammation, that is like encephalitis. Any condition which is affecting the respiratory center, in that situation it is happening. Understand what I'm saying? So this is called as what? Chain stroke respiration. Okay. The next one is rhythmic waxing and waning respiration is seen in. See, all the questions, whatever we are discussing, you know, it is asked in ESI, RRB, JIPMER and AIIMS NORCET examination. Okay. So rhythmic waxing and waning respiration is seen in. Let's see the options. Hyperventilation, hypoventilation, chain stroke respiration, and the last one is orthopnea. And here the right answer is option C, chain stroke respiration. So waxing and waning respiration is seen in the chain stroke respiration. What is waxing and what is waning? Here you can see in this image, it is clearly mentioned. See, in the last question, I discussed that in a chain stroke respiration, hyperapnea will be there, hypoapnea will be there, apnea will be there, right? The hyperapnea is also called as what? Waxing. Hypoapnea is also called as waning. Waxing, waning, apnea. Waxing, waning, apnea. So this characteristic is present mean that is called as what? Chain stroke respiration. Is that clear, guys? So the next one is the person who becomes shortness of breath with little exertion, such as when eating a meal, he has what kind of respiration? So here the question is very simple. There is a shortness of breath for a patient after taking a meal. So what kind of respiratory dysfunction the patient is getting? And they have given 4 options like chain stroke respiration, stridor, hyperventilation and dyspnea. You know about chain stroke respiration. If there is any disturbance to the respiratory center in case of any injury or infection in the brain, that time only you will be getting the chain stroke respiration. So just neglect that option. The next one is stridor, upper airway obstruction. In this image, you can see very clearly about the stridor. Stridor means upper airway obstruction. That is laryngeal. Is in this condition or any upper airway obstructions, in this condition, what will happen? Stridor will be there. Hyperventilation. In case of acidosis, hyperventilation will be there. Dyspnea. Dyspnea means the patient is having some kind of shortness of breath or suffocation. Okay, it is also called as air hunger, AIR, air hunger. Okay, so if the patient is having shortness of breath or suffocation, this kind of characteristic is present in the breathing after the heavy meal means that condition is called as what? Dyspnea. So here, which is the right answer? Option D, that is dyspnea is the right answer. Okay, guys. So hope everyone understand the concept. So far we discussed about Biot's respiration. Second one is Kussmaul respiration, chain stroke respiration, and this one, dyspnea. Okay. So if you have any doubt anywhere in this content, you can drop your message in the chat box. Thank you very much for watching the video and all the best for your upcoming examination, guys.